Hey everyone, Dr. Erik here from Med Health, where we help educate and provide care for who? For the caregivers like you. So let me ask you a question. I'd like the followers and the listeners to comment below right now. How many of you actually have this specific issue when it comes to you're coming to your mom, you're coming to your dad, your loved one who has dementia, and you're saying, Mom, you got to take these meds. Here's these meds. And mom or dad's like, I'm not going to take it. Not taking these medications at all. Comment below. Is that you who's watching right now who has this problem? Well, if it is, this video is exactly for you. Let's get started. All right. So let's look at the statistics because statistics are important. Number one, 36.6%. 36.6% of caregivers experience what? That their loved one with dementia refuses to take a medication at least sometimes. 36.6% of you listening. All right, 30%, the 90-day drop-off. Patients who start an anti-dementia medication abandon it within 90 days. Interesting. Okay, let's get into some more statistics. Annual attrition. 44% of dementia patients in the US who become entirely non-adherent to medications within their first year. Those are the numbers, right? And this is coming out of the Alzheimer's and Dementia Journal of 2022. Now, what happens? Like you're listening, you're like, all right, these are some of the numbers, and I have this in my family, right? You're saying, but how does that affect things? Well, number one, cost of care, $4,465 annually. Average prescription drug costs for dementia patients, significantly amplifying the financial waste of unused medication, right? All these meds that are not being taken and are somewhere in your kitchen cabinet or medicine cabinet or in a closet somewhere. I remember I used to do house calls back in the day, and I used to come into people's homes. I opened the closet sometimes to put my coat, and I'm looking, and there's bags and bags of unused medication. Now, this was from 2021, $4,465. The cost of medication, some of these medications now are very, very expensive. And you're saying, well, what does it matter to me? It doesn't affect me. Yeah, it does. You're a taxpayer. That medication ultimately comes out of your pocket. So be mindful of that. We don't want to have no wasteful spending in the closet somewhere. Number two, this is the big one, guys. 71% risk increase. In what? Patients non-adherent to medication face a drastically higher risk of hospitalization. Now, I'm not saying that every single medication that your loved one gets, oh, you got to take. I'm just saying that you have to ask a question to your doctor. Is this the right medication for me? Who prescribed it? What are the side effects? But after you did your due diligence and you did your research and you've come to a conclusion with your medical professional that these are the right medications, if your loved one does not take a medication, 71% risk increase of going to the hospital. That's an interesting statistic. So let's keep it moving. So the first thing you have to understand is, well, what is the reason why my loved one is not taking their medication? And there are 4 top reasons that I want to tell you about. Number one, it could be physical. Dysphagia. What is dysphagia? Difficulty swallowing. 45% of patients experience difficulty swallowing as a baseline who have dementia. So that's very interesting. Not only that, but some of the medications that we give, like cholinesterase inhibitors or rivastigmine, which I'm not saying not to take, but just for you to understand the dynamics of it, right? They cause GI symptoms, dizziness, GI-driven discomfort, right? So that's one thing that could be the reason. It's not just behavioral. It could be a physical issue. Okay, number two, it could be a cognitive issue. What does that mean? Well, the person living with dementia actually doesn't think they need medications. They don't think they're sick. They think everything is okay. So they're saying, don't give me those meds because there's nothing wrong with me. I don't need to take these medications, right? That's number two. Number three, psychological. 97% develop behavioral and psychological symptoms like paranoia, right? Oh, this caregiver, my daughter-in-law, my son, the only reason they're giving me these medications is because they want to kill me, because they want to take all my money and they want to take all my assets. That's why they're giving me the medication. So I'm going to stop taking this medication because otherwise they're going to poison me. So anytime they give it to me, I'm going to say, no, it's not for me, right? That could be another reason that you just may not know about, and you're just assuming that they're refusing due to their dementia, right? So psychological. And then environmental. Disruptions in caregiver. Some other caregiver now came in and they're not used to that caregiver. It's a different timing, right? It could be later on the day that you're giving medications. And if you watch the video up here, you'll see that we talk about sundowning. I give a great presentation that you should not miss. You should learn about what is sundowning, right? And so it could be just a sundowning syndrome where in the evening they're agitated and they don't want to take the medication. So it could be just a timing issue. Now, what do? Right? How do you overcome this? And by the way, if you're a caregiver listening to this and you're saying, wow, I love this. This is so educational. And you're thinking, well, I wish is there a way I can get this one-on-one where I have like a care navigator that goes through this stuff with me? The answer is yes. MedBetter Health, my organization, is part of a new Medicare program that actually will help you get your own care navigator and your dementia proficient provider who can go through this one-on-one with you every month. And if you're interested, right, we'll talk about it towards the end, but if you're interested, I want you to look up, here's a website that I want you to visit. You can read about the program, fill out a quick little form, and we'll reach out to you and get you started. And also, I want you to comment below if you're interested. In the comments, write interested, and we're going to reach out to you and send you the link. All right, moving on. What do you do? What do I have to do if I'm coming up to mom and mom says, I'm not going to take my medication? Well, first of all, stop. Step one, do not force. I'm not saying not to give medications. You have to give medications, or God forbid, you can have a stroke for certain meds, you can have a heart attack, or sugar can go. No, I'm just saying for that moment, stop for a second, right? Don't force. Assess. Understand why your loved one, your person living with dementia, is not taking their meds. Start to think about, is it one of these 4 reasons that we talked about, right? Okay, so stop and assess. Step 2, always rule out an acute reason. Is it a new caregiver? Is it a new medication? Is it a UTI? Is it confusion? Is it a new setting that they're in? Is there something acute that didn't happen before, that they took their meds all the time and now they're not taking it? Try to look deep. Is there a reason, right? That's number 1. Number 2, reset and retry. Try again later using evidence-based backed modification. What does that mean? So I'm going to go through 4 of them with you. Try again later by, number 1, change the environment. Sometimes if you give it in the same room, in the same place, your person living with dementia identifies that experience negatively, and that triggers them not to want to take their meds. If it's in the bed all the time that they're laying, or if it's a specific chair that they're sitting in, try to switch it up a bit. Take them out to the living room, take them to the balcony, maybe take them outside and say, hey, right? Try to set the setting. Now, I'm not saying all these 4 are going to work. I'm saying these have been proven to work in certain cases, and you won't know unless you try. And I want you to comment below, what have you tried that worked before, right? Think about it. What things have you tried? Because people listening around the world, they may get some advice from you. What are some of the things that you tried that worked below that you want to share with a common community? But these 4 are scientifically backed. Number 2, swap the messenger. Try a different caregiver, right? I remember with my grandmother, right? My aunts used to give the meds and she would take it, but sometimes they would have some trouble having my grandma take the medication. They would come up to me, and I would be the one who would say, come on, Grandma, I'd really love for you to take the medication. And Grandma would be like, oh, okay, okay. And she would actually do it. Why? Different caregiver, different messages, different emotion, different experiences for your person living with dementia. Oh, this one's a big one. Offer autonomy. This is huge. A lot of the times in dementia, it's about control. And so remember, when a person's living with dementia, they feel that their control is being taken away from them. These are accountants, lawyers, doctors, hotel owners, you name it, anyone who used to be in control, mothers, fathers, right, grandpas, and now they're losing their sense of control. So what you want to do is you want to give them a sense of autonomy. So I would say, hey, Mom, these are the 5 medications that the doctor said that you need to take. Which one do you want to take first? Is it the blue pill or the purple pill? Right? And now Grandma or Mom is like, huh, I'm in control. Well, I'll take this one first, right? So give autonomy. Or would you like it with water or juice? Or, Mom, you have to take this medication. The doctor said that it's important for you to take this medication. Do you want to take it at 9 o'clock or 9:15? Look, it's 9 o'clock now, or do you want to do it at 9:15 or 9:05? Right? Give her the sense of control. That's an incredible thing. And this works a lot. Anchor to authority. A person living with dementia still has the cognitive bias of recognizing authority, right? The doctor told me to take it. Try the approach of, hey, Mom, look at this letter. Look at this. I just got a phone call from your doctor. Remember Dr. Wiley? And Dr. Wiley said that you have to take this medication today. It's so important, Mom, okay? Here, look, Dr. Wiley, right? And you show a picture of him or a letter from him. That also works a lot. So those are some of the challenges, and you won't know unless you try. And the biggest question I want you to do is this one. Stop and assess why. Why is your loved one not agreeing to take the medication? Now, this is also very, very important, guys. This, I'm telling you, this information that I'm giving you here, we provide as training as part of our guide model, right? It's a new Medicare program. As I mentioned before, if you're interested in having someone explain things like this to you, the caregiver, comment below interested, or go to the website that you see over here on your screen and look at that video, fill out the form. It's an incredible opportunity for you to get this knowledge. But I continue. So, step 4, simplify the regimen. What does that mean? Well, you never want to make these decisions by yourself. You obviously always want to speak to your doctor. But let's say Mom's taking like 6 medications 3 times a day, right? There's this very difficult schedule, and it happened over the years. You go in and you talk to your doctor, you talk to your pharmacist, and you say, look, is there a way that we can simplify this from 3 times a day to 2 times a day, to 1 time a day, right? Can we stretch it out? Are there any simple ways? And so consolidating to one's daily dosing yields an improvement in adherence. So you could ask pharmacists, hey, Mom is taking 3 different pills. Is there a combination of those pills? And if the pharmacist says, oh yeah, by the way, there is, go to your doctor. Hey, there's 3 different pills that Mom is taking. It's a lot. Can we combine it in those pills that are 3 in 1? I'm telling you, that goes a world of a difference. But all you have to do is actually ask, right? Because if you don't ask, you don't know. So that's one. Number 2, switch formulations. This is a biggie. So for example, there are certain medications like donepezil, rivastigmine, memantine, right, that we typically give for dementia. But there's other meds for high blood pressure, right? They come in different formularies. For example, there's a pill, rivastigmine, but there's also a patch. The patch, rivastigmine, is incredible. You put it on once a day, and it's great. Meaning, if there's pain with swallowing or issues with swallowing, that goes away. Now, donepezil used to have a patch, but it's no longer available in the U.S. market. Okay, what about memantine? Well, there's memantine that are tablets that are difficult to swallow sometimes, but they're also memantine solution. It's a liquid solution. So sometimes that may be a lot easier. And here's another one. This is called Namzaric. It's a combination between donepezil and memantine, right? They took two drugs and they put them together. Now, are there tablets of Namzaric? Yes, there is. But there's also these sprinkles that you could open and put into applesauce. And then, mom's not thinking that she's taking a medication. She's actually taking applesauce, right? So those are some of the things that are super, super important. So I hope that you found this video very, very helpful. This is for you, the caregiver. And I would really like for you to comment below. I'd like you to do a couple of things if you found this useful, right? Number one is subscribe, whether it's through a newsletter, whether it's you're watching this on YouTube, on LinkedIn, if you want to follow us on Instagram or Facebook. I'm telling you, you'll get a lot of value of it, right? Number two, I want you to comment below. Think about the biggest challenge you've had with medications, and if you were able to overcome it, or if you're looking for an opportunity to overcome it, right? Number three, I want you to seriously consider and understand that you're not alone in this journey as a caregiver. There are so many resources out there for you. It's just you don't know. And sometimes because there's so many resources, it's so hard for you to figure out which one to grasp first. So that's why Medicare came out with a new program that MedBetter Health participates in. And who is it for? It's for the caregiver like you listening. So let's say mom is a person living with dementia, and mom has traditional Medicare, and you're a caregiver, and you need education like this, you need guidance, but not only education. Let me ask you a question. Has there been times when you've been exhausted and you know you have to go do shopping for mom or stay with mom over the weekend, and you're like, I just wish I could catch a break? Now, what if I told you that this program actually pays for you to catch a break? For a private duty home care agency to come to your home, take care of mom, Medicare will pay for it, and you could catch a break. How does that sound? If you're interested, a couple of ways. Number one, comment below in the comments. Click on the link that you see right over here. You'll see a video about our program with Medicare. Fill out the form. We'll reach out to you, and I'm telling you, this will change your life. I'll see you in the next video.